Tēnā rā koutou katoa, nau mai, haere mai, karanga mai. Welcome to Hey Ara Waiora, a 3-part webinar series that explores health equity from a Māori perspective. Ko waiau, ko Tuari Potiki tako ingoa. I'm the project lead for Whare Tukutuku, and I'm co-hosting this with Eugene from our comms team, who's part of the Drug Foundation. He Ara Waiora webinar series explores what is health equity. Can we get there? Are there approaches of practice in place now? Why does health equity matter? And webinar 1 of the series is about the Tiriti of Waitangi as a pathway to wellness. So I'm going to hand it over to Eugene, who will just run us through the outline for tonight.
Kia ora koutou. So ko Eugene Karahan tōku. The webinar running will be an introduction of Whare Tukutuku, our guest speakers, and the subject matter our guest speakers will be talking to, followed by a 10-minute presentation from each of our guest presenters, and a 30-minute Q&A follows, inviting you to submit questions for our guest presenters. This webinar has been recorded for future reference should you want to share and or listen again.
So, kia ora anō. Just a little bit about Whare Tukutuku. It is a partnership between Te Ora and the New Zealand Drug Foundation, and we're developing an approach to alcohol and drug harm. We sit with whānau intently to listen to what is working in our communities and what we can learn from what is working and what isn't working. With their permission, we have challenging conversations about complex issues that can get in the way of whānau hauora or wellness. The goal is to build the capability within those communities to ensure that whānau have access to help when they need it, and that the Whare Tukutuku understands that within the whakapapa of our communities is incredible potential for new scopes of practice and a new workforce. Whānau can be a part of building robust and intergenerational resilience, standing within their own mana and their own wellness and in their own communities. So just hand it over to Eugene to introduce.
Kia ora anō. So our guest presenters are Vicky MacFarlane and Tuari Potiki. They are the presenters for webinar 1, Treaty of Waitangi, a pathway to wellness. Tuari Potiki, nai tahu no Kati Moi Moi Waitaha. Tuari Potiki has an extensive experience working in health, education and social sectors. He has been a director of Māori of the University, the director of Māori studies at the University of Otago's Office for Māori Development since 2012. Tuari was previously the General Manager of Strategic Operations with the Alcohol Advisory Council of New Zealand and the Deputy Chief Executive of the Ngāi Tahu Development Corporation. Tuari is also Chairman of the New Zealand Drug Foundation, current board member of the Southern District Health Board, a previous board member of the Canterbury District Health Board, and the Canterbury Community Trust. In 2013, Tuari was appointed to the Ministerial Forum on Alcohol, Advertising and Sponsorship. He has previously been an executive member of the Drug and Alcohol Practitioners Association of Aotearoa, New Zealand, DAPANS. He was also a senior Māori advisor to the National Addiction Centre, that sits within the University of Otago. Tuari has recently been appointed to the Needham District Licensing Committee and is chair of Te Runaka Otako Finance Committee.
Kia ora Tuari. Kia ora anō. Kia ora Vicky. Just to introduce you, Vicky is the eldest daughter of a father of Te Arawa descent and a Pākehā mother from South Auckland. She was the general practitioner for 19 years, working in a number of practices in both Auckland and Wellington. In 2010, Vicky started working at CADS Auckland, and in 2011, Vicky was appointed as the lead clinician of the Medical Detoxification Service, providing clinical leadership to both the inpatient and community detox services. She's completed her training in addiction medicine with the Royal Australasian College of Physicians in 2015, and since 2016 has been the New Zealand branch chair of the Australasian chapter of Addiction Medicine Committee. She was a member of the Expert Advisory Group of Drugs from 2015 until 2018. Vicky is also an honorary senior lecturer in psychological medicine with the University of Auckland, and is involved with the teaching and supervision of trainees and students. Vicky's goal is to provide the highest quality medical care with compassion and kindness. What a rock star. Kia ora.
Me, Vicky.
Kia ora, Vicky.
So now it's our intro to the subject matter. In 2016, the Waitangi Tribunal started hearing submitters for the Y2575 Health Services and Outcomes Treaty Inquiry. The hearings are held in three parts. Stage 1, primary healthcare. Stage 2, mental health, Māori with disabilities, and alcohol, tobacco, and substance abuse. Stage 3, pending. Despite 4 separate transformations of New Zealand's healthcare system since the 1980s, review upon review into New Zealand's healthcare system, the transformation and reviews have done little for Māori. There have been hundreds of submitters. Māori health is described as a humanitarian crisis. A humanitarian crisis. Māori on average die 7 years before the majority of New Zealanders. There is no sadder and or starker indictment of a systemic failure of a people than that tangata whenua's live years less than other New Zealanders. 1 in 3 Māori suffer from mental illness. 1 in 4 Pacifica people suffer from mental illness, compared to 1 in 5 of the rest of the New Zealand population. Suicide and or intentional self-harm is almost twice as likely in Māori than in non-Māori. These numbers are even higher in youth. The list of Māori health inequities is voluminous. It is abysmal. Y2575 makes it clear New Zealand's health care system is failing Māori. An important demarcation. Māori are not failing the system is failing Māori. Equity as promised in Te Treaty has failed to deliver health equity in every single metric that measures health and well-being. The Ministry of Health, as part of its treaty obligations, has incorporated 5 core tenets in aligning their objectives with Te Treaty and equitable health outcomes. Tino rangatiratanga, number 1, the guarantee of Māori self-determination and mana mutahake in the design, delivery and monitoring of health and disability. Equity, the Crown to commit to achieving equitable health outcomes for Māori. Active protection, the Crown to act in achieving equitable health outcomes for Māori, ensuring that its agents and its treaty partners are well informed on the extent and nature of both Māori health outcomes and efforts to achieve Māori health equity. Options, to properly resource kaupapa Māori health and disability services to ensure that all health and disability services are provided in a culturally appropriate way that recognises mana mutahake hawara Māori approaches. Partnership, the Crown and Māori to work in partnership in delivery and monitoring of health and disability services. These treaty tenets beg the obvious question, given the systemic health failures of our health system in the past 50 years. How will words be transferred to the equity given the intergenerational failure of our health system to serve Māori equitably? Do Māori have concern to be cautious? Are there approaches of health equity in place that are working? And or are there approaches of equity in practice in other organisations that the healthcare system can look to emulate?
Kia ora, Eugene. So we're just going to invite our first speaker, Vicky McFarland, to start the conversation tonight, and encourage folk to join in the Q&A if you've got any questions.
Kia ora,
Vicky.
Vicky.
Kia ora whānau. So I'm just going to share my slides. Just bear with me for 1 minute. So thank you for the kind introduction. And look, I was preparing this this presentation, Eugene said, oh, you need to have a beginning, a middle, and an end. So look, I would need to start with the beginning, I think, because the beginning is important to give a context from where I'm speaking from. I'll just slide. So look, I am from Te Arawa. I'm the oldest daughter of you know, my two wonderful parents, my mother, who's the only daughter out of 6 from Māori, and my father, who's one of 13 children and of Rīparata and Ken McFarlane. So look, I grew up, I've got 3 sisters, and I guess the next picture I wanted to show you are my, oh, here we go. You can see we're kind of a really beautiful example of Mendelian genetics. I've got one blonde, blue-eyed sister. I have a very Māori sister, and then myself and my other sister are kind of in the middle. And look, I think really what I need to say is that in the 60s and 70s, we kind of grew up in no man's land. That's how I see it. And myself and my middle sister and my other sister, we kind of could slide in between Māori and Pākehā worlds. My youngest sister, Tracy, you know, she definitely suffered from just sort of racism right from the time she was young, and she still does get asked to get her bags checked at the supermarket. So look, I think I grew up in that Pākehā world with all those privileges, and I went through high school, I went through med school, and then I did my training all in Auckland, and then in 1993 I started to work in general practice in East Auckland. And I guess my journey could have finished there in a nice middle class practice, but I then started working in 2004 at Ngāti Whātua, Orake, and I worked there for 4.5 years, and at that point I also started to get quite involved with the Māori Doctors Association, Te Ora, and the Māori group of GPs, Te Ako Rangara Māori. And I continue to work with those services. So look, I mean, after Ngāti Whātua, I worked for quite a few different high needs practices, some kaupapa Māori practices and some mainstream practices, but all high needs. And then when I went into addiction training in 2010, obviously I kind of have dabbled back in general practice backwards and forwards, but have done addiction since then. And I guess I need to say that I've really been aware, you know, that the people that I see, well, that my colleagues have a really poor understanding of addiction. The other thing is that I think they really have a poor understanding of the need of equity and how to deliver good health services to Māori. And I don't really think that, I need to be honest about this, but I never really felt brave enough to stand up and actually say anything until quite recently. So I also really need to say that I'm not a public health specialist, and I'm not a Māori health expert, and I'm not a treaty expert. So what I'm going to kind of talking to today is really from my personal kind of experience, and also I'm driven to talk today because in the last 30 years since I've been a doctor, absolutely, as Eugene said, nothing's changed. And I can sit back and look at this and think, you know, nobody's challenging anything, and really, as Paparangi Reid has said, it's immoral and it's unjust. So I really want to, I kind of feel like the time's come to say something, and I really hope that after tonight, it might kind of inspire some other people to do the same. So I guess that the other thing you could argue is, am I being a little bit unrealistic and a little bit naive to think that things are going to change when they haven't done for like in 30 years or whatever, and these, you know, awful kind of stats just remain stubbornly unshifting. And if you know, I mean, we can show you millions of lots of data about the inequities that exist across the Māori health, for Māori in health, and I think we all know that. And I mean, I guess the biggest one is that really, you know, Māori die, you know, have twice the rate of dying. So I think it's just such an important subject to talk about. I think before we go any further though, I just want to be really clear that we're talking about equity and what that actually means, and why it's different to equality. And, you know, equity is really defined by the World Health Organization as the absence of absence of unfair and avoidable or remedial differences in health among population groups defined socially, economically, geographically, and demographically. So it's around action requiring not only access or equitable access to healthcare, but actually means actually working outside the broader context. So when I've been kind of like looking into, you know, how presenting this, which has been quite enlightening. I just think these are big issues, big topics. We could talk about these things for hours about one part of every, you know, aspects that we're talking about tonight. And I kind of want to help direct you maybe as well to some of the things that maybe might be useful. And I think when we're talking about inequities and for Māori, you know, there's a very good talk by Dr. David Tiffany Leach last year for Hutt Valley DHB. And I think, you know, he really summarizes well and how we an understanding of equity, and also talks a lot about unconscious bias, which again is another topic that we could kind of talk about for a whole hour. So I would suggest that you'll recommend that you have a look at that, but he kind of looked at the Institute of Health from the States and looking at the, you know, the causes of inequities, and he kind of put his own spin on it, and he talks about cultural incompetence, and then you can kind of talk about safety with that in a minute, and historical trauma and institutional racism and poor social determinants of health. And then he kind of also overlaid that with historical trauma, and he talks about that, and it's something that I don't think we talk about a lot, and I don't think a lot of my colleagues understand that. So I think that was a really good summary, and I would encourage you to watch that. But I think the other thing that really struck me when I was listening to that, and when I look at this picture, is that it reminded me of the Cutting Edge conference last year when we had Laura Porter coming, and she spoke about the adverse childhood experiences, and it reminds me of all those things that are contributing to patients with addiction, clients who have addictions. And I feel like our clients or clients that have got addictions have kind of got this double whammy going on. And you know, from a really personal kind of thing, I remember when I started doing addictions, and you know, as a GP, and I went to speak to some GPs, and so the kind of GPs are at the lower level of medicine, you know, seen as that kind of like low. And then to be a Māori GP is like, oh, even a little bit maybe down. And then now to be an addiction doctor doing addiction, I was kind of really like, it was like the attitude from my colleagues was really quite shocking. And I guess that's probably one of the things that actually really motivated me to keep going with this and try and help prove things. So Eugene mentioned about the YA2575 stage, you know, the report, the Hawara report, and you know, that is incredibly important. But I think there are a few other things that I wanted to talk about, because when we're going to be advocating for helping to reduce inequities, I think all of us would be, you know, it's really important that we know about these documents. And I mean, we can say, well, you know, there's been heaps of documents, and that is absolutely true. But, you know, what I've kind of seen when I looked at them is that the language has kind of changed in the last year. And there's some words that are in these documents that weren't in these documents a few years ago. So I think that it's really useful to have a little bit of a knowledge about these documents, because you know, they're kind of talked about, but we don't really, maybe we forget what they say or what they're about. So I kind of think we need to start with He Kora Waioranga, the Māori Health Strategy, and that is a bit older, but that is still, that's relevant because the Māori Health Action Plan came out of that this year. So I just want to briefly mention that. I'm not going to say much more about that actually. I do want to you all know about the He Waioranga and the Mental Health and Addictions Inquiry, and that overwhelmingly talked about, you know, the Māori's rights under the treaty, talked about more kaupapa Māori services. It's very, very clear that they had a commitment in that document to health equity and the treaty. So that's the kind of probably with one of the, you know, the one that we all know. There's your Y2575 Waitangi Tribunal report, and as Eugene mentioned, the stage 2 of that is coming up, and that's all relevant to addictions. So I think that's something we all need to kind of keep a close watch on. The second part thing, the other document I think that we all need to know about is the action plan that was released this year. That's kind of a treaty again at the top, and it's kind of really, I mean, it's a pretty short document and it's all quite visual, but some really clear kind of mandate in that as well. And then they've got some pretty clear outcomes that they want from there. They're quite delimited to 4, but again, quite important. I think the other big report that came out this year is the Health and Disability System Review, the Simpson report, and that again, you know, was very clear that, that things need to change. I mean, a little bit of, you know, this word racism starts to creep in here now, and I think this is kind of really important, and that we're actually starting to name it. I guess the only thing to say about this Health and Disability System Review is that there was a bit of, as you probably all know, that they recommended a separate Māori Health Authority, but they didn't really go far enough, and there was a lot of concern, and George Laking, who's the president of the College of Physicians that I'm part of, talked about it really, that really it's not enough, you know, it's not acceptable and it's not going far enough. So, yeah, so here's this, that's just something that was in the news. So I think the other thing, although it's not a document, but it's kind of just shows that things, the dialogue in the media, the dialogue is actually starting to change in lots of kind of areas. And, you know, Emma Espiner, who some of you will also know, did this podcast on Radio New Zealand that was also worth kind of having a look at, because, and she kind of talks about the fact that she did that because she was angry about the statistics and these endless reports of inequities that haven't really changed anything. And that, you know, and the other thing that she kind of highlighted was the fact that the government had responded pretty quickly to COVID, but we've been not responding to the Māori health inequities for years. I do want to mention Te Rōpū Whakakaupapa Urata, who a group of public health and other physicians and other doctors who really stood up and spoke about inequities and highlighted this during the COVID epidemic. So I guess the thing is that I feel like I have now the courage. I'm not going to say I need to. I do have the courage to actually start speaking out and actually talking about this. And I'm going to be brave, and I'll be courageous about this. And you know, I think not only the national documents, but also the colleges that I'm part of, both the College of GPs and the College of Physicians, they've got really strong mandates around this as well. And so kind of have, prior to even this webinar and prior to all of the thinking about this too much, I'd already started to kind of make some changes in what I can do personally. And then of course, and then just recently, well, in October 2019, the Medical Council of New Zealand, together with Te Ora, the Māori Doctors Association, started to kind of really seriously look at Māori health equity. And I don't know, some of you will know, but so David Tiffany Leach, who I spoke about before, is the chair of Te Ora, and Curtis Walker, who is a Māori doctor, is chair of the Medical Council of New Zealand now. So as luck would have it, they kind of came up with released this new report only a month ago on cultural safety and health equity for Māori within our services, within the health system. And then they kind of came up with these 10 recommendations that they gave to us, to doctors, kind of a bit of a guideline around what we could do. So thankfully it kind of coincided or aligned with what I was already doing. But anyway, so you know, and again, the language was strong, and so what am I doing? I'm kind of, I guess as well, I think sometimes this kind of, this can become overwhelming, and you think, well, look, it's not changed for years. So it's hopeless. Like, I just don't know what to do. And I think really it needs to start well, I felt that it needed to start from me. You know, I am the one, I have to start this for me and do what I can do. And then, so I now have, you know, I can make changes, a little bit of changes. I can put equity on the agenda of my clinical governance meeting. I can start talking about systemic racism. And if we have time, we can talk about white fragility and the response of white people to that conversation. But I can start asking that all our staff that we in our mainstream service are safe, culturally safe. I can also, you know, we can start looking at auditing and data collection, and developing clear partnerships. I think one of the biggest things in medicine and health is a workforce that's responsive. And so my little part of that is to try and encourage lots of young Māori, like doctors and med students to think about addictions or think about this as a career pathway. And we're really fortunate. We've got 2 great GPs just joining us soon. And also help improve knowledge of addictions in general, to be honest. So I guess that's at a personal kind of, and also where I work level, and then maybe even nationally, I'm, also able in some of my roles to actually start advocating for change for drug policy and some of the other things. And hopefully with Whakatukutuku, maybe, also have a broader outreach. So look, I guess that's kind of, I don't have the answers apart from saying that I think we all have now behind us a pretty clear mandate, and that we can be brave and courageous about having these conversations wherever we work. But yeah, so thank you.
Mihi ki a koe, Vicky. Lovely kōrero, brave and challenging. We thank you for that. I'll just hand it over to Tuari to have your conversation, your kōrero with the folk who have joined us tonight.
Kia ora.
Mihi, Vicky.
Yeah, kia ora, Vicky. Hei mihi atu tēnei ki a koe. Nō reira, ka mihi atu ki a koutou, I whakaroko mai nei. Ahakoa, no hia, ahakoa koe, ane ka aku ne mihi atu ki a koutou. Mai o te pōti nei, ane ka mihi mahana atu ki a koutou katoa. Kia ora. And thank you for joining us. And yeah, just that was awesome, Vicky. Thank you. Look, and thank you for the invitation to have a bit of a kōrero. I'm not sure that I'm going to need the whole 10 minutes. I don't have. I've got 3 slides which I'll put up very soon and talk at, and then I've got a few other comments to make. But then I'm really interested in the Q&A afterwards and the kōrero and just what people are thinking about and talking about. And I'm hoping that some of those listening will ask some questions or make statements or give us some stuff that we can sort of respond to and maybe help in some way. I'm not sort of arrogant enough to believe that this is in any way gonna change the world, but I think it's great to have this kōrero and to be talking about these issues, particularly right at the moment, given all of those things that Vicky's just outlined, and then throw Black Lives Matter into the mix. And it just feels to me like there's an environment currently that we haven't had before. And I think Vicky, again, summed it up really well. When she talked about, finding the voice to speak up to racism and to speak up to those things that many of us have just stuffed down in the past. We've just put it down to how it is. What do you expect when you interact with that service, with the Pākehā service, or you go, you expect to have your name pronounced incorrectly, to have, potentially to have mistakes made. So I think we have low expectations, and I responded to accordingly. I think for whatever reason, I think now is the time to challenge that and to say no more. That's enough. You've had your turn. It hasn't worked. So now it's our turn. So look, I'm going to talk about having turns. I'm going to have a turn now at trying to put up this PowerPoint. And I'll see if this works. It worked a minute ago, much to my surprise. Now apparently I've got to do something else. Maybe that. Can you see that? Or am I just showing it to myself? No?
No.
No. Hang on. Okay, I'll try. Go back to Zoom. Go to share screen. Well, maybe this is not going to work. Never mind. I'll talk to them. Well, that's a shame, but anyway, they were great slides. Typical way, it worked before, but anyway. The three slides are, the first one actually follows on from that slide that Vicky showed before that talked about equity and equality, or equality and equity. And I think I've got another version of that same slide, and rather than talk about equity, it talks about justice. And it reframes that slightly to be a conversation or a picture of justice, and particularly social justice and what that means. And it then goes on to sort of remove that whole fence and to talk about liberation. So I really like that, because I think it is about moving towards liberation and looking more widely at issues of equity and where it's, you know, what its purpose is, what it's leading to. And it is about liberation and freedom. I had another slide that was about equity and citizenship. And it talked about, it was an attempt to reframe the conversation away from disparity, away from all of those things really, and to start talking about citizenship and our rights as citizens, not as some hard done by disparate group, but citizenship. And that was actually what the treaty guaranteed, was equal rights of citizenship. And to achieve that, it talked about oretetanga, which is about equity, and it's about us having being equitable, and oretetanga being the same. So really, again, that's about moving past the whole concept of Māori responsiveness, which has probably been the last 20 years, where we've had all sorts of Māori responses to things. We've had, you know, Māori managers of government departments, and when I've been in them, so I'm guilty. We've got a lot of services that have got one or two Māori staff, and we've talked about responding to Māori. And I think, again, you know, we're now moving into a new era where we've moved past that, and we need to be thinking more about equity, what it means, and you know, what is it? What is it that we're talking about? For me, equity, it's fundamentally, it's about power sharing. And again, I think Vicky sort of touched on some of this before, and it's about power sharing. It's about jointly prioritizing and determining what we're going to be doing together, jointly making decisions. So it's moving past even consultation, or advisory groups, because, you know, advice doesn't have to be taken. So I do believe that we're moving into an era where we are talking about a more concrete and genuine partnership and relationship that involves power sharing, and the power is about decisions over what we do and how we do things that affect our lives. So this is kind of, I know it's difficult in clinical situations, because often we end up in working for services that are quite strictly sort of governed as to what you can do, what you can't do, the models you use and how you use them, how many times you can see someone, you know, there's a very, it is quite, it's clinical, you know. So I guess, you know, one of the challenges is how you involve others in some of those clinical or some of those decisions that you're making. I mean, really, it's moving past, it's moving away from the mindset of, you know, there are broken people who need fixing, you know. or that there are injured people who need healing. And it's actually moving more towards, I mean, to me, we're not either of those. We're sovereign people who need empowering for those other things to occur. And I know that sounds a bit sort of cliched, but that probably for me is more about where I think we need to be heading, and we need to be figuring out ways of working together that are more about sharing power, sharing resource, and sharing and decision making. Y2575 and the Simpson report. I mean, Sam Cooke. A change is going to come. It's coming whether people sort of like it or not. And I think it's been really clearly signalled. We know already, for instance, that changes that the ministry are already acting on the Simpson report, and they've got a team working in Wellington to implement the recommendations, and that's going to happen. There's going to be a major overhaul, and I'm really. I think we need to be a part of that. In fact, we need to be central to it. Otherwise, it's going to be done to us again. So I think, the time is absolutely right for us all to be having this conversation about how we achieve equity and how we can do things a bit differently to achieve equity. The third slide I was going to show really just was it just talked about citizenship, and that with citizenship there's an element of freedom, there are some rights, and there are some duties or responsibilities. So again, that slide was just about reframing the whole discussion away from reducing disparity or reducing inequity, and actually making it more about empowering and about rights and about supporting people's citizenship, of this country that we all share. So really, they were going to be my sort of opening remarks. And, the question at the start was, is the treaty a pathway to wellness? And that's a really interesting one, because I can say that when I did work for my tribe a few years ago, I worked for the development arm, and the money that we got came from iwi. So it wasn't government money. There were no strings attached. So we were able to do what we wanted, what we needed to do with that resource, without having to jump through any hoops, without having to ask anyone's permission, without, so there was an element of freedom in that. Not being beholden to anyone else, not having, not dancing to someone else's tune, because they give the putia. Because there's always conditions on government money. With always, obviously, there has to be, because it's our tax dollars. But so there was an element of freedom in having that autonomy and authority and ownership of both the resource and the outcome. So yeah, part of me thinks yes. But I don't know if I'd call the treaty a pathway. I think, to me, it's more like a template or a map. I think because, and on that map, there are a whole lot of different pathways. I wouldn't call the treaty a pathway. And I just also often, when I talk about this stuff, I refer back to a local example of a chief just up in Moiraki, just up the road from where I am here. And his name was Mātiaha Tiramorehu. And he was around at the time that the treaty was signed. And in 1847, he wrote a letter to Governor Gray, and it said, we signed your purchase agreements and everything. And in those documents, you promised us native schools. First of all, land, that 10% of all the land sold would be set aside for native reserve. You promised us native schools and native hospitals, and none of those things have come to be. You haven't given us any of those things. So and that was actually the start of the Ngāi Tahu claim that was settled. That was 173 years ago, and in some ways we're still having the same sort of conversation about how we manifest our rangatiratanga, how we self-determine. How do we get control, or at least have a say over our own well-being and our wellness and our own futures? So I always, when I think of this whole talk about equity and moving forward and and well-being and wellness, and it's always good for me to be reminded that this isn't a new thing. We've been having conversations about this in different forms for a long time. And I think now, given, like I said before, the environment, there seems to be a willingness that I haven't ever experienced before, particularly from government, to look seriously at equity and what it means, to consider power sharing. And Vicky talked about the Māori Health Authority and the Ministry of Health. And, that's, ideologically, I think a great idea, but as Vicky said, they disempowered the whole thing by kind of pulling it in-house and making it what will essentially be a quasi-government department. It actually needs, in my view, to be the opposite of that. It needs to be Māori/iwi owned and governed, that sits alongside the ministry to determine health priorities, health outcomes, and then how you measure performance. Because fundamentally, if if you've been around government, the role of any bureaucrat, with all due respect, is to give effect to government policy. It's not to challenge it. So if you have ministry officials running that authority, it's not going to be a Māori authority. It's going to be a ministry Māori authority, a Māori ministry authority. You know what I mean? So again, I think there's a good idea on the horizon, but it's likely to be derailed potentially, and won't be able to achieve its full potential because they won't be willing to, or they don't seem to be willing to trust iwi/Māori with making decisions, or having access to that resource. So anyway, look, that's enough from me for now, and I look forward to apartheid and those sorts of things. Kia ora.
Kia ora, Tuari.
Ngā mihi, Tuari, awesome.
Ngā mihi. So I'm just noticing there are quite a lot of questions coming through, and so I'll just... Leanne would like to know, when will kaupapa Māori hauora tohu have the same value and recognition as colonial quals? If the colonial system doesn't work for Māori, why do we continue to demand hauora workforce to have these quals, especially those that work for kaupapa Māori services? This is culturally safety too. Would anyone like to have Vicky, would you like to comment on that? So the query is around, why do we continue to use colonial systems that have proven to not work well in a kaupapa setting?
That's a good question. Yeah, I think also, so when you talk about quals, you're talking about, what is that? Was that an, what is it, like a abbreviation for?
Qualifications.
Oh, okay, cool. Well, that is a good question. I mean, I think that is probably part of the thing that needs to change. I mean, I think there needs to be qualifications that are recognised, that are more relevant for working in a kaupapa Māori environment. And I think you're right. I don't think that it's not appropriate. And I think it is it should have equal value. I guess, it's really hard from my perspective when you're, so say from a medical or a nursing perspective, there are going to be certain qualifications that you kind of need, you know what I mean, as a baseline. But I absolutely agree that that there should be other you know, qualification requirements for people, for others, for working in other services, and perhaps there could be a qualification for doctors that are, you know, that meet a bar for being safe to work in a kaupapa Māori service, you know, and once you've got your medical qualification, a bit like being some kind of specialist, you know what I mean? So I think that that's absolutely right. That's part of being self-determining. That's part of actually having that partnership. Maybe that's, yeah, it's important.
Yeah.
Vicky, I have a question for you. You mentioned the term white fragility, and kind of how does that manifest itself in your world, and kind of what does it create?
Yeah, look, this is another thing that I'm not really an expert on, but I don't know, some of you may you know, be familiar with Robin D'Angelo. So she wrote a book on white fragility, and I really encourage everyone to have a look at some of her videos online, because it's really fascinating, and she's a very interesting person. But so she wrote the book White Fragility in 2018, and then she kind of had a bit of a renaissance in this year in the context of the what Black Lives Matter and George Floyd. And you know, I think it's around, you know, people becoming quite defensive. I mean, when you start talking about racism, everybody kind of has a response to that. I'm not racist, you know, I treat everyone the same. You know, I'm really open-minded. I know, you know, so that everyone has a response. But I think what white people don't realize, like I was saying before, is that they grow up in a white world where they have privilege, whether they like it or not. And so it's just kind of, I think, you know, this is like I say, another hour. She talks for an hour on one of her presentations, and we could talk about it. But I think we need to be prepared in how we respond to that response, to the response when we start talking about racism, and be aware that Pākehā will respond in a way, and so that might, you know, be seen as being resistant. So I think everyone, you know, really useful to have a look into that and to be familiar with that work, because if we're going to start actually talking about racism and then we need to be aware of that as well. George, there's another Professor Greg Phillips, who's from Australia, who is an Aboriginal public, you know, doctor. Person, and he's done a lot of work on this as well, because you know, this is a big part of the difficulties with changing institutional kind of racism as well, you know, and the medical workforce.
I'll jump in just to both of those things. The first one, in response to that, it asked the question about the qualification. I mean, that's a really, really good question, and I think, sort of like Vicky said, I mean, I'm in two minds. On one hand, I agree absolutely that Western knowledge is privilege, without a doubt, right throughout the whole system. And of course, I work in a university, so I see that all the time. And it's a comment often made by our Māori academics, that more weight is given to Western knowledge and thinking than other forms, including mātauranga Māori. So I think that's not, I think that has to change. Having said, and I also think that there have been attempts, I think, in the past to create, you know, we have our wānanga, we have these different, there was a thing called Tangaru Learning Systems a few years ago. That was an attempt to validate mātauranga Māori and Māori expertise. And my impression of that was it was grounded in a very Māori framework and Māori-centric and Māori worldview. And to that, some clinical skills were added, like counselling and different therapeutic skills. But fundamentally, but it was added to a mātauranga Māori knowledge base, you know? And I thought it worked really well. And I think that is, for me, where we should be. That should be validated, and we should be doing much, much more of it. To me now, the whole system is the other way around, where we have very Western-focused courses that have a Māori bit. And I used to do some of those. I was the cultural clip-on. So, but I do think there is room. We do have to have a look at that, about how we privilege information and knowledge. But bearing in mind, like I said before, there are some things where there is some specific expertise needed that I'm not convinced or sure that we have, you know, naturally in Te Ao Māori. If I have got diabetes, or if I've broken my leg, you know, I want someone to be able to fix it using good Western pain relief, and and you know, so I won't have a limp at the end of it. You know what I mean? So there is a place for those skills and things that we may not have, or that will do things, make things better. But I do think it can be delivered in a Māori way of doing and being. The other question about white privilege, yeah, look, it's a very, very good point you raise there, Vicky, because if we don't talk about it, help people understand what it is, and kind of take it away, then every time we have these discussions and we talk about systemic racism, or we talk about whatever it is, it almost naturally occurs in some people, and you end up in this. It's not it stops it from being a learning or just situation, or from a conversation, because people get sort of entrenched. I had one example of it where I work a wee while ago, as I was talking to someone about another person who had been helping with this culture change project. And I suggested to this person that this other person needed some Māori sort of training, treaty kind of, you know, because in my view they did. There were a lot of things they didn't know, and I think it would have made their job easier. They went to their boss, who came at me that I had been disrespectful, and you know, she was very upset and all this stuff, and wanted me to apologise. And that was, you know, when I thought about it after, it was like, hang on, I've gone for having the temerity to suggest that someone might need some cultural education. I've become a perpetrator. So that's why, you know, these discussions around privilege and ghosting and all of these other things, whitewashing, all of these other ways that our needs are discounted or diluted is so important. Kia ora.
Kia ora. We've got another question here, and it's around, it is around racism. So the query is, what do you guys think are the key pillars or focus areas to developing a national plan in addressing racism? So what do you think are the key areas in
a very big question.
I think you mentioned one, Tuari, and that is talking about it, having conversations about it. So I think, and exposing it for what it is. I think that's definitely part of it.
I'll go first, and I'll try and be brief. Again, I always try and use examples of things. We've been doing some work at the uni down here on racism, and we have obviously a bunch of very, very clever people, academics who have researched it, who have got, you know, screeds of information on racism. And when we wanted to address racism on campus, there was a very strong push to bring 6 academics into a room with all of their research to tell us what, you know, the answer. What we ended up doing was thanking them very much for their kind offer. And we went out and we pulled together a group of students. There's an Asian club, and an Indian, and a Middle Eastern club, Pacific, Māori, LGBTQ, like all these different students, plus staff from different groups. And we asked them to give specific examples of racism that they had experienced. It was, you know, I mean, it was very profound, but it was, from my perspective, it was fantastic because they were real examples, and they became things that we could then deal with or deal to or try and change. So I guess what I'm saying in a roundabout way is, I think you need to start, I think you need to start with the people who are experiencing racism, get them around the table to talk about the experience and what they believe, or what we believe needs to change, rather than, with all due respect, well-meaning other people. They can support the change, but I firmly believe that the people who are experiencing it in its different forms should be driving what needs to change. Kia ora.
Okay. So groundswell, grassroots driven.
But I still think we need to ensure, I mean, I do think that it's helpful to have that that dialogue or raise awareness amongst Pākehā or white people that they have privilege, and they, you know, I think, you know, maybe a lot of them have never thought about that. Do you know what I mean? And the mere fact of growing up white in New Zealand is giving them, you know, they've got twice as likely to live, you know. I mean, I don't really think that Pākehā people think about that. And I do think those are the conversations we need to be having as well, because it might just shift the dialogue around, like you said initially, Tuari, you know, poor Māori, and they don't eat well, and they don't do this and they don't do that, you know, and it's kind of like gets away from that victim blaming, and it's actually becomes more about what about the person. I don't know. I feel like it needs to be two parts, and two bits to it really. And I don't think these conversations have ever been had that I've seen in you know, to be honest, not in the mainstream.
Question, Vicky, you know, the clinical epistemology and the Māori epistemology, you know, they kind of draw from Western and kind of rongoa Māori, you know, looking down the curve, is there a place in the future whereby the two meet in the middle, and that they are taught in our mainstream education institutions? Is that even a possibility?
Look, I think that, you know, the mainstream education, like the universities are doing them really well, or way better, like heaps better, right? So that report that the Medical Council did show that they've got really good teaching in the med schools, and that they've got much big, you know, they've got some awesome teachers now in the med schools. I think that where it all starts falling apart is when people go out into the hospitals. Because there's no good role models. Like my son is, you know, in the young medical student, and he's like, there's no role models, mum. I go and I learn all these Māori models, and I learn about, but nobody models that way of working with Māori. So then you get scared to, you know, to do it, or to you know, use the models that they've learned or whatever. So I think there definitely is, and one would like to think that we're moving there towards that. But I think it has to start in medical schools and the medical system, and then it needs to be continued. And, you know, that's where that whole workforce thing comes in, doesn't it? It's around having Māori doctors that can model, you know, that way of working with patients. So I do think it's possible, but and as we know as well, there's more Māori doctors. Still only 4% of the doctors in New Zealand are Māori. So It's like low numbers, but it's getting more. So, you know, one might see that in the future that it will. I think, you know, I think it definitely can happen, but it's going to take a while.
There are so many lovely questions rolling in, and one of them is flagging, you know, what happens around people, especially Māori, who are using drugs. And the question basically, do you think drug reform is the way forward for Aotearoa?
What a great question. What a great question.
Well, I can give my 2 cents worth. I do think drug reform is the way. I mean, I'm going on to work. I'm hoping I'll be able to get on a working group around this for the College of Physicians. But I absolutely think we need to look at you know, decriminalising and making it a health issue and not a criminal issue. So I'm pretty clear about that. Don't know about Tuari.
Hell yes. Yeah, absolutely. And it has to be. We have to have reform, and we have to have meaningful reform. Like, you know, I'm still pretty gutted about Friday's decision, and to be honest, that's why I'm a bit down today and don't feel like I'm sort of fully onto it. But you know, the way that the law works and favours some over others is fundamentally wrong. And if you look at any of the we talk often about Johann Hari's book, Chasing the Scream, or Professor Carl Hart. He wrote a book called, I think it's High Times or something. They detail where the kind of drug war rhetoric came from, and that whole attitude. And it was absolutely race-based, without a doubt. It was deliberate. Initially in the US, they were wanting to target Mexicans and African Americans. We've got our own, if you go to Google and look up New Zealand Opiate Act, and you'll see a couple of examples of legislation here in New Zealand that discriminated against Chinese people, because in early last century, it was Chinese coming over here to mine gold, who were perceived as second-class citizens. They were treated horrifically. And the law said that. It said that no policeman can go into a home unless you're Chinese. So the racism around how drug law is enforced isn't new, and it hasn't just been applied to Māori. So I think we have to have, so there's a racism aspect, and then there's just, the law we've got at the moment was established in 1975. It's not fit for purpose. I don't think it ever has been. We need another way of looking at drugs and how we deal with particularly how we deal with drug users. And again, it sounds cliched now, but it is about having a health-focused approach. The Drug Foundation have been supportive of decriminalisation of drugs for a long time, not just cannabis. We're talking about possession, and so what we call social supply. So we're talking about basically users. So if we're not talking about not going after the dealers, the meth cooks, and all that. Not that. It's for individuals, because when you get down to that end of the hierarchy, 9 times out of 10, those individuals have got drug problems themselves, and they're supplying to others, as you all know, to support their own habit. So we've always been very, very strongly supportive of drug law reform, and there's no doubt that it will benefit Māori and other brown people more than non-Māori, because currently the law punishes Māori and other brown people more than non-Māori. So drug law reform, I think we have to have a new way of thinking about this whole issue and what our role in it is as people trying to help people with drug issues. Kara.
Well, I'm just really aware of the time. We've reached that time, and I just want to invite a final comment from our panelists before we finish up. So Vicky, would you like to make a final comment to our the folk who have joined in tonight?
Sure. I think my final comment would be really to be brave and be courageous, and encourage all your peers and all the people that you have contact with to do the same. Because I think if we get a collective kind of a movement, not a movement, that sounds kind of weird, but that's how we can make meaningful change. And I like to see it all across the whole sector, and that's so and thank you for inviting me on the panel. That's my final point. Yeah.
Kia ora, Vicky. Tuari, final words. Last words for the evening.
It's so big, it's so important, and it's so now, and it's such a part of what we do. I've always thought, I'm imagining that the group of people who are listening in will come from a whole bunch of different places. There'll be quite a few practitioners, there'll be alcohol and drug people, there'll be Māori, there'll be, all sorts of people. And I like to believe, just because it makes me feel better, that one of people are driven by different things. We've all seen that some are driven by the acquisition of wealth, and it's all about or glory or fame or whatever. To me, the people that I've interacted with pretty well my whole life who work in this field aren't driven by those things. They're driven by a genuine want, a genuine desire to help other people. And to, you know, I mean, I know that sounds a bit airy-fairy, but to me it's true. The people I have met, they could be doing other things, but they choose to do this work because they believe, like I do, that those people in need of our help and support are amazing. You know, they've all got huge potential, and all they need is some guidance. So, I believe that with that goes a sense of social justice and a sense of what's right and wrong and a sense of wanting to do the right thing. So I'm just wanting to acknowledge that's already sitting there in people, and it's not going to be the way forward isn't going to be easy, because we do have to have these difficult conversations, and things that we've done a certain way for a long time are going to need to be changed, and change always involves anxiety, and change is difficult. But I am eternally optimistic that we have this group of people who are the right people, to be supporting and leading the change that we need to make. Vicky talked about cutting edge, and I know for at least the last couple of cutting edge conferences, they've been deliberately quite challenging. Some of these issues have been front and center. The reason that's been done is because we know that group of people are up for it. It wasn't accidental. So look, I just want to reinforce that we have, we've got clinical skills and ability and all of these other things, but fundamentally we've got bloody good people who want to do the right thing. And to me, that's half the battle won.
Well, ngā mihi nunu kia koutou. I'd just like to especially thank our guests tonight, Tuari Potiki and Vicky MacFarlane, to all our viewers who joined. Hey Ara Waiora, Webinar 1, thank you for joining. We hope that that you have learnt something new or been validated in something and enjoyed yourself. So I'm just going to leave you with a whakatauki, which was gifted to Whare Tukutuku by our kaumātua Witi Ashby. So whiria te mauka harakiki, whiria te mauka tangata, puritia ka tauka o tā tātou tūpuna, hei tauka mā ka uri whakatupu. So thank you all for being here. Pō Māori, pai tō koutou. Kia ora.
Ngā mihi kia koutou.